to talk to us about today. So if you don't know, the American Psychiatric Association Foundation has many initiatives that focus on one goal: a mentally healthy nation for all. Through community-based programs, fellowships, awards, and grants, they address critical mental health needs and direct resources where they need it most. And the program that we're specifically talking about today is called Notice, Talk, Act at School. The Notice, Talk, Act at School mental health education program trains educational staff to notice warning signs when a student might be showing signs of mental illness or other distress. To talk about mental health, the program discusses how to talk to students to show care and concern, and to act appropriately in referring students to resources, and this approach shows how to act when appropriate to connect the student to support services. So joining us from the APA Foundation is Christopher Seeley, MSW. Chris, raise your hand. Now, Chris is the Program Director of School and Justice Initiatives for the APA Foundation. Prior to his appointment at the APAF, Chris served as Direct Therapy Intern at Michigan State University Counseling Center. He provided short-term therapy to a diverse client population while also assisting in weekly multicultural and racial awareness training. Chris was also the Assistant Community Director, supervising and coaching resident directors at Michigan State. Christopher facilitated social skill building groups for at-risk high school students at Star Commonwealth Detroit, along with delivering individual and family therapy. He also has experience as an advocate and field instructor for the Michigan State University Adolescent Project, was a program director for a support and education group for low-risk juvenile sex offenders, a juvenile detention specialist for the Ingham County Youth Center, and a case manager for a national youth mentoring organization. Christopher earned BAs in psychology and criminal justice, as well as a master's in clinical social work from Michigan State University. Joy Lloyd Montgomery, MPH, is the Program Manager of School and Justice Initiatives for the APA Foundation. Prior to joining APAF, Joy was a research project coordinator at the University of Maryland School of Medicine, where she led a project focused on understanding the barriers to online grocery shopping for SNAP-eligible families to inform the expansion of the USDA's EBT online program. At UMSOM, she also served as a wellness specialist, providing technical assistance to schools across Maryland in implementing their district's wellness policy, and managed a health leadership program for elementary and middle school students. Her previous work experiences include national provider and pharmacy outreach for the Patient Access Network Foundation, health promotion for the Montgomery County Department of Health and Human Services, and short-term crisis and supportive counseling for 211 Big Bend in Florida. Joy has a BS in psychology from Florida State University and a master's in public health from George Washington University. And last but certainly not least is Raul Andrews Jr. Esquire, the Executive Director of the American Psychiatric Association Foundation. Before joining the APA Foundation, Raul held several progressively responsible management positions with AARP over 15 years, including most recently as a vice president and a member of the AARP National Leadership Team. He was in the private practice of law before joining AARP. Raul holds a JD with honors from Howard University School of Law, a BA in psychology from Texas Southern University, and a management certificate from Agile Executive Leadership Program at the Georgetown University McDonough School of Business. Raul also serves as president of the Bar Association of the District of Columbia, and I know that he's a humble man, but if I'm not mistaken, recently awarded an award from the President of the United States. So we're very fortunate to have the folks from the APAF here, and without further ado, I'll turn it over to Chris and Joy.
Thank you, Dr. Posios. All right, it works. Cool. We're good. We're good. Thank you again, Dr. Posios, for that wonderful introduction. Dr. Posios did a wonderful job of highlighting a lot of my professional experiences, but I'm also a person with lived experience. My first suicide attempt was when I was 12 years old. The only reason I'm here today is because of people like you who cared about students, saw something in me when I didn't see something in me. So before we tell you about our program, I just want to thank you for showing up today to hear about the program, but really showing up every day for the students in your community to try to really produce the most productive members of society, right? That's really what we're here to talk about today. So I just wanted to pause and just thank everybody for that before we get started. So I'm going to pass it over to Joy, because we're going to start with a little bit of fun and a little bit of trivia. So hopefully y'all are ready for a little fun and games to get started on this very serious, but also we like to add a little levity to this serious topic. So Joy?
Oh, this is just our agenda for our presentation today. So like Chris said, we're going to start with trivia. I'm going to give a brief overview of the youth mental health landscape, and then I will pass it to Chris. He will give you an overview of our Notice Talk Act at School mental health professional development training, talk about SAMHSA, a new grant that we just received, and our different delivery models, and then we'll do some Q&A. And for everyone online, if you have any questions, please feel free to put them in the chat. We do have people monitoring them. And for trivia in a second, please put your answers in the chat. That would be great. All right, so we're going to start, and we're going to have 4 questions. The first 3 are actually based on an American Psychiatric Association poll of about 2,200 adults. So the first question is, what percentage of adults agree that it's important for schools to provide mental health training for staff? Yell out some answers. C, 60 to 70%. What do other people think? B, 80 to 90. D, 40 to 50, so everything. Nobody thinks A, though. You had a hand raised. What do you think? A, 20 to 30. Okay. So the answer is actually B, 80 to 90% of the adults that were polled. And actually it was 87% of adults agreed that it was important for schools to provide mental health training for staff. Are you guys surprised by that? No? Some people, not really. All right, our next question. This is a little easier. You only have 2 options. So true or false, most parents would be comfortable referring their child to a mental health professional. False. Some truths, but mostly false. The answer is actually true, which is a good thing. We should be happy. So it was 72% would be comfortable referring if they noticed a change in their behavior. Unfortunately, this was a little less for Black parents, but it was still above 50%. And then mothers were more likely to refer than fathers, which I know you guys are not surprised. All right, our third question. What percentage of adults believe that it's important for schools to connect students to mental health support? A, 84%, B, 67%, C, 59%, or D, 93%. Everything. I heard a lot of A's, though, and that is the answer, A, 84%. And our last question, this is not from the poll. What is the average number of years between first signs and symptoms of a mental illness and connection to care? A, 8 years, B, 9 years, C, 10 years, or D, 11 years? I heard a 10. What are other thoughts? A lot of C's, 10 years? The answer is actually D, 11 years. When we first created our e-learning module, which Chris will go over, it has a question like this, and the answer was 8 to 10 years, but unfortunately it has now increased to 11 years. Yes. And so, speaking of data, we are going to talk a little bit about youth mental health before the pandemic and then youth mental health during the pandemic. And so before, we had about 20% of youth had a mental, emotional, developmental, or behavioral disorder. 50% of adolescents have had a mental health disorder at some point in their lives. About 10% of youth's depression was severely impairing their ability to function at school, home, or with their friends or families. And then, unfortunately, of those with depression, about 60% of them didn't receive any mental health treatment. And this rate was even poor in areas where access wasn't an issue. All right, so I think I would be remiss to not talk about the school-to-prison pipeline, which refers to the practices and policies that contribute to the funneling of our youth into the juvenile justice system and later the adult criminal justice system. And this is something that disproportionately affects youth of color across the United States. And so roughly 70% of students who are referred to law enforcement are Black or Latinx. And we know this is a huge overrepresentation than what their prevalence is in the general population. Students are also who are suspended or expelled are 3 times more likely to be in contact with the juvenile justice system. 3 times more likely. And like I mentioned earlier, this also significantly increases their likelihood to end up in the justice system as an adult. And so I alluded to this earlier, but the most significant indicator predicting which children will be suspended is not the type of offense, but the color of their skin, their special education status, what school they go to, and whether they've been suspended before. And so this is contributing to our why, because these students tend to be exhibiting disruptive behaviors. We understand that that makes it incredibly difficult to foster the learning environment that we want for the rest of the kids. But we really need to remember that these disruptive behaviors are a sign that something is going on with that child. And for us to be able to respond in a more trauma-informed way with care and expressing concern and being able to build a relationship with that student so we can better understand what is going on with them and how can we get them support. All right, so now I'm going to go to the youth mental health during the pandemic and now. So this was based on a 2021 survey of high school students that was conducted by the CDC. And they found that 1 in 3 students experienced poor mental health, and this was worse for our LGBTQIA+ youth, and 1 in 2. 44% of those students reported feeling sad or hopeless for 2 or more weeks, and so much so that they stopped doing usual activities. But then recently, still from the same data, but recently they disaggregated it so we can get a better look at, okay, how is this affecting different populations amongst those students? And so they were looking at teen girls, and they found that it was actually a higher percentage. So like I said, it was 44% for all, but for teen girls, it was actually 57%, so nearly 3 in 5 felt persistently sad or hopeless. 1 in 5 seriously considered suicide, and again, that was all. And again, it was worse for teen girls at nearly 1 in 3 seriously considered suicide. And for LGBTQIA+ youth, it was 1 in 5 attempted, not seriously considered, but attempted suicide. And so these are, again, reminders that we need to make sure that we're creating additional support for all of our youth, but making sure that we're keeping in mind how the world is affecting our young girls and our LGBTQIA+ youth. And so the data that I shared in the trivia and the CDC is really just letting you know, giving you insight as to why this is important that we're doing what we're doing. We can say that youth mental health is a crisis, and we know that that is the case, but seeing the numbers makes it a little bit more sobering. And as you all know, students spend so much of their lives in school. And so schools are such a vital lifeline to be able to help these struggling youth. And being able to have safe and trusted adults in school, whether that be their teachers or their mentors or the cafeteria staff, janitorial staff, admin, it helps foster school connectedness, which improves their mental health outcomes. And I don't know if you guys were able to pick up their folders. There's some out there if you haven't, but there's a resource in there that has specific statistics about how the school connectedness improves mental health outcomes. But I will just say that students who felt close to people at school had a lower prevalence of poor mental health, sadness, and that sadness and hopelessness that I mentioned earlier, and also fewer seriously considered suicide. So all that to say, being able to foster relationships with these kids does matter. I know that you all do that, but it does actually make a difference. And so I am going to shortly pass it over to Chris, who is going to talk to you about how we support schools and their ability to do that. I know that a lot of them are already doing that, but how can we help make that better when there are uncomfortable conversations that they need to navigate? What are some tools that they can use in order to have those conversations? And when they're concerned about someone and a referral is needed, what do they do? How do they act? Who do they refer that student to? So I'm going to pass it over to Chris now.
Thank you, Joy.
Oh, welcome.
Oh, a little feedback there. All right. Before I start into the program overview, I just wanted to emphasize one thing. We are a mental health organization, right? Like the American Psychiatric Association Foundation, we care about mental health, but it's not just about mental health, right? There are a lot of different things impacting that student's ability to show up as their full selves at school, right? It could be trauma, it could be grief, it could be housing, it could be food, it could be clothes. There's so many different things that could be impacting that student, and that's really what this program is about, right? Joy emphasized relationships. That is the key to the program, your ability to build relationships with students. And then it goes from there. Once you can notice those changes, what we talk about is disruptive and withdrawn behaviors. And the reason that we talk about disruptive and withdrawn behaviors is because we redeveloped the program. So the APA Foundation has been involved in this work publicly since about 2006. 2017, I was brought on to redevelop the program. As you can see here, it wasn't just me as a clinically trained social worker sitting in a dark closet by myself thinking about, like, how do I improve the mental health of students, right? Because I am not the expert in anything, right? I have some knowledge base, I have some passion, but I brought together a group of experts. So child and adolescent psychiatrists, addiction psychiatrists, school mental health professionals like counselors, social workers, and then the actual people who would be receiving the training. So teachers, parents, coaches, advisors. And we brought them all together and said, this is what we're doing. Redeveloped it, moved away from diagnostic behaviors. You will not hear depression, you will not hear bipolar, you will not hit schizophrenia in any of our curriculum. Because you're not mental health professionals. We don't want that expectation to be put on you. What we want you to do is notice disruptive and withdrawn behaviors, because that's what you notice in school as educators. Some kid is just being disruptive and we need to address that. We haven't seen this kid. They've withdrawn from activities. What do we do then? That's all we're asking you to notice as staff members. And that target audience, we know that there are specialized roles in every school, right? Teachers got to teach, food service got to feed those bellies. Janitorial staff, more now than ever, have to clean those hallways, right? Everyone has a specialized role within the school. It's our belief that everyone's role is to notice, talk, and act. That is a shared responsibility amongst the school. Key framework, Dr. Pozios did a wonderful job highlighting it in his introductions, but it's notice, talk, act. Notice disruptive and withdrawn behaviors, talk. We use motivational interviewing, interaction technique of OARS as our evidence-based practice to guide that conversation. How do I build a relationship with this student? How do I gather information to a point? We don't want them to become investigative detectives. We are not trying to re-traumatize students, right? You see cuts on an arm, I don't need to ask you about cuts, all right? I can already make that referral happen. I can still start a conversation to build a relationship with you because that, again, to Joy's point, really matters to that student, and I'm getting them to the people who can help ask those questions, right? Ask the right questions about why those cuts and diffuse, okay, well, it's, I have a cat and it scratched me. Well, they know how to handle those conversations versus you just being as an, like, oh, they have a cat, yep, scratches, move on from it. No, we're doing an action, we're getting somebody connected, and that's where that act comes into play. And it's about any resources that your school has access to, right? So if you have counselors, social workers, you know, you have mental health access, but you might have bus tokens, right? Transportation. We don't think about it, transient families, right? Move from house to house, couch hopping, maybe separated. When they have to change bus routes and multiple bus routes, that's an additional financial cost on the family that can cause financial stress. Usually youth, like, I grew up in a very poor family. Parents think they do a really good job of hiding the financial woes. We know what's going on. That stress that we take on and we take with us to school. These are all things that, as our program really helps staff members to understand, the more resources that you have, the more likely you are to refer that student to them. So we redeveloped the curriculum. We went out into 10 different communities to pilot test it. I'm really focusing on the middle and high school pilot tests. We did do some testing actually here at Michigan State University as well. But what I really want to focus on is the 91% of educational staff continue to use Notice, Talk, Act key framework throughout the school year. And that's intentional, right? We really want to make sure that it isn't just a one and done training. Oh, okay, check the box. No. Are you actually using Notice, Talk, Act through the school year? Are you noticing? Are you talking? Are you acting? How are you referring? Are there certain situations that you're still struggling with? We want to try to continue to help schools throughout a 12-month period. These are some numbers that might be interesting to you from our pilot sites. From 6 of them who continued to give us data before COVID impacted us, we were able to see a 70% reduction in truancy rates, an 89% reduction in discipline referrals, 99% reduction in major mental health events, which we identify as suicides. I want to dive a little bit deeper into this number before I move on. What we saw is they had one suicide ideation happen at all of those 6 schools throughout that 1-year time frame, reducing it almost to 0 in almost every single school. And what they saw is actually the PHQ-9 screenings continued to increase, so they're catching it sooner. They were able to say, something's not right with this student. Let's get them through this screening, and then let's develop resources so we're not getting to that ideation, we're not getting to that attempt in the bathroom where a lot of students were attempting, unfortunately. And then it's 171 increase in support services. Again, I want to emphasize it's support services. It's whatever support services your school has. How are we getting students connected? I think a lot of, Dr. Pozios alluded to the youth mental health crisis. A lot of what we're experiencing in the youth mental health crisis is because we're not catching it sooner. We're letting it cultivate and fester internally for years and years, poor coping mechanisms, and then by the time they reach adulthood, they're in the justice system, and then I'm working on the other side of my job to decriminalize mental illness and reduce the amount of people who are booked into jail every year for SMI. So this really, we see this opportunity as a way to stop the matriculation of community members with SMI, trauma, grief that have been undiagnosed into our adult system as well. So program components, online assessment, pre-post. We really just want to get that first one, making sure what's your baseline knowledge and are we improving it. E-learning module, 30 to 40 minutes self-pace. What we're trying to do is establish a baseline of knowledge for everyone coming into the classroom portion. We know that everyone's a little bit different when it comes to their knowledge around mental health, where their facts are, where they're not, where just their comfort level. So how do we get everyone to a similar baseline so that we can focus on skill building and how Notice, Talk, Act as a framework can be deployed within your school community? And that's where that in-person training comes into play. 90 minutes, really designed to fit into those half-day professional development days that most schools have, once a month, once a quarter. We ideally, just speaking from my heart here, ideally I would like to do this in August or during those professional development days right before the school year so we can really kick it off. This is how we're going to be approaching mental health for your school community going forward. We spend time working with the school. As a clinically trained social worker, cultural competency, cultural awareness is very important. So what we do is we spend a lot of time working with the school. What are the things that the students are struggling with? What are the things that staff struggle with students? What are you seeing outside in the community that both students and staff are bringing into the table, right? Because what we know, and I mean, we're a mental health organization, we know that staff in schools and their wellness is something that is a top priority for administration. If it's not, it should be at this point in time. And so how do we continue to think about the whole staff and the wellness and how we might be approaching certain conversations? And then free resources for the school community. Joy alluded to the folders that were out front during check-in. We included one of our newest resources for how to support refugee students that our school fellows help to develop. But there's additional resources that we look to from the feedback that we get from schools. So it might be directed to individual schools, but also if we continue to see trends across all of our trainings, we continue to develop new training resources to help further that. Both for staff, but also parents and caregivers and mental health professionals. How are we furthering this Notice, Talk, Act shared language throughout the whole community? Man, I'm so good at this, I kind of already hit all these bullet points, so I apologize. Mental health facts, early warning signs. Again, disruptive versus withdrawn behavior. We're moving away from any diagnostic behaviors. That introduction to motivational interviewing. We touch on mental health resources that are available, understanding that every single community, even in a school district, your access to mental health resources could be different from one school to the other. Really what we want them to do is be able to define ORs for me. What's the O, the I, the R, the S? We're going to work on that skill building within the actual classroom training, and then state the 4 potential outcomes when you start a conversation with the youth. What do you think those 4 potential outcomes could be? You see something, you notice something. What are the 4 potential outcomes that could happen? Any ideas? Yeah. There's not a referral needed, right? I can build a relationship with a student. I can close this conversation, leaving the door open. That's on me as a facilitator. I forgot to say, if you do have a question or an answer, you're supposed to hit the microphone on the table so that people will hear. But that's one of them. Any other ideas on potential outcomes? What's maybe the scariest situation that you might experience? You notice something? Joy, you know this. I might have to call him. I feel like I've been walking on this side of the room. Any ideas? What's the scariest situation that can happen? You notice something, you try to talk to the student. Y'all are doing it to him right now. Y'all are literally doing it to me right now.
The student doesn't want to talk.
Yeah, they don't want to talk, right? They don't want to engage with me, right? Apparently, they're moving me away. This is my spot now. Maybe. We'll figure it out. We're good. Okay. So yes, you start a conversation and the student doesn't share. Are we all right? A little feedback. I'm not going to move. Feet are planted. I'm going to become a tree. I'm going to grow leaves. So you try to start a conversation with the student, but the student doesn't share, right? First thing that we try to talk to staff, don't take it personally, right? You have your own personal biases, so do the students, right? I'm 6'3", I have a beard, I could look like stepdad, right? And they don't want to talk to me because I look like stepdad, and I can't take that personally, but I can ask the question, who else would you like to talk to today? Who else can I connect you with? Who else in the school do they potentially have a relationship with? Maybe they don't want to talk to anybody today. That's all right, but guess what? We're telling somebody, because again, those withdrawn behaviors, see, I'm trying to move, my roots are unplanting themselves. We need to tell somebody. So how are we informing the support services team that, you know what, I saw Dr. Pozios walking in the hallway today, they didn't want to talk to you, but something that my gut tells me something's not right. Well, guess what? You're staff member number 3 that came and told the support services team. That's a pattern. Now we can maybe go and talk to that student and understand what might be going on a little bit sooner. In-person training, in-depth discussions. We kind of gave you a little teaser with the trivia. What I said earlier is so true. Everyone's shared role and responsibility is to notice, talk, and act. And what we try to do in that classroom training is to break down all of those silos. We don't want the science teachers all sitting together. We don't want all the paraprofessionals sitting together. We want it to be a mix at every single table, because these conversations are not just to be had with your little groups that you work with every single day. These conversations are to be had across the school community. And also, if you're in the staff lounge and you hear, man, I noticed that Chris was falling asleep in class today. Well, did you talk to Chris? No. Okay, well, let's come up with a plan of action, right? It's also a way for you to kind of hold each other accountable. We do role plays to practice those ORS techniques, familiarizing themselves with that referral process. Every school is different. What we want to emphasize is warm handoffs. Because when you do notice a student and they need that referral, how are you actually walking with them on that journey of whatever they might need for support services right from the get-go? Whether that's walking them physically, calling someone down, it's up to the school, and we work with them on, like, are there languages? Are there keywords, excuse me? Hey, I need a blue folder. Can you come bring that down? That's a referral. I need a red folder. There's a crisis happening. I need immediate assistance right now, right? How do you start to develop some of that language so that they know what is needed right then? One of the big things we continue to see with every single training is that there is a pretty big confusion between privacy versus confidentiality, and how educational staff members have privacy, but the support services team has that confidentiality, and what that means. Why information sharing is only maybe a one-way street at times. So how do we continue to break that down is operationalizing Notice, Talk, Act. What happens when the staff member does their job of Notice, Talk, Act? How do we share about all of that good work that happens behind the scenes so that the staff member really gets this understanding that, like, without me, this good work cannot happen. I have to do my job of Notice, Talk, Act so that they can help to support this student, help to wrap around services for them. And really what we want them to be able to do is navigate a conversation whenever a student is exhibiting those disruptive or withdrawn behaviors, identify when a referral to support services is needed. It's always my belief I'd rather you refer 100 students, only one need it, than not refer one student, right? That's up to that support services team member to really understand what that triage is, and then explain the school's crisis protocol and referral process. Every school is a little bit different. We understand that crises are going to happen, whether that's, again, a student who themselves are in danger or they're putting others at danger as well, and how do we continue to influence and encourage schools to follow that, and then improve their referral processes. So, as Joy alluded to, we were awarded a SAMHSA grant last year for 5 years. One of our target locations is Oakland County, Michigan. So we are currently looking for schools to receive this training, Notice, Talk, Act, for free in the Oakland community. Some of the big things that we will be asking or requiring as a part of this grant is number of discipline referrals, number of students through it, number of major mental health events, number of people referred to support services, and then some staff data as well around knowledge, attitudes, and self-efficacy. This is to allow us to show the impact of the program overall through the SAMHSA grant, but also to help the school to understand what are the impacts that we're providing them as well. So if there are additional data points that you are interested, one of the big things Joy and I always talk about is test scores. We know that's a big thing for schools. Is that a data point that you want us to look at, right? We have a division of research within the APA that can help us with some of those additional data points if the school is interested in it. Delivery models. So we have 2 different delivery options. We have a direct delivery where it'd be like myself or Joy going out to the school and delivering that classroom curriculum. The typical cost is $20 per person. Again, there's no cost currently through the SAMHSA grant. The model that we believe is probably the most effective and for sustainability and longevity is the train-the-trainer model. That's where, like, we would get in a room together just like this with the support services team, and we would train them up over a 4-hour period on the curriculum so that they could deliver it when it was necessary and needed, and continue to develop that to new staff members over time. The typical cost for that is $10 per trainer and then $10 per staff member as well. So really just $10 per person across the board, but again, through the SAMHSA grant, there's no cost at all. Again, free. Yeah, and that was the end of my presentation. We actually ended about 5 minutes earlier, so we have more time for questions. So Joy is here, I'm here, Rawls here as well, so happy to take any questions. And then again, for anybody online, please drop questions in the chat, and we'll make sure we get those answered here in the room as well. Yes, Tris.
How does this curriculum differ from youth mental health first aid?
Yes. Great question. Youth mental health is a very complex puzzle, just very blankly. What our belief is that administrators and some high-level individuals should probably get youth mental health training because it's a little bit of a deeper dive into what mental health is. Very, very much more disordered, diagnosis focused, and it's a longer curriculum overall. So as far as a time commitment goes, the time that we actually ask the staff members to go through is under 3 hours over a 12-month period, right? So we're doing the e-learning module that's 30 to 40 minutes. They do the classroom module that's 90 minutes. And then if there's any additional resources, or we try to make it 5 to 10 minutes of like coursework on the e-learning, on the learning management system, excuse me. So very small lift from the staff members in particular. And we think it's a good complement. Notice, Talk, Act, again, we've really tried to understand, you know, when I went through the redevelopment process, I sat down and I tried to remove my clinical social worker hat and said, like, well, if I didn't understand mental health, what are you asking me to do? Like, what are you really asking me to do? And what I'm asking staff members to do is notice a change of behavior. I'm asking them to start a conversation so they can build a relationship with them, and then act. Get them to who's been trained, and really try to simplify that role so that there is, I think, a weight hopefully lifted off of staff members' shoulders so they don't feel like I have to diagnose and I have to come up with a treatment plan because we know that you care about students. That's why you are hopefully in this job, right? And because you care about students, we need you to get to the person who's been trained to handle these very complex issues.
Thank you. I think that's a really good complement to that curriculum because what we're facing now is that time commitment in working with schools and the cost of youth mental health first aid and that. So it's nice to have that everybody gets this and then select people.
Yeah.
So that's helpful. Thank you. And I know we have a question online.
Yes.
2 questions online.
Okay, the first one is, can an organization be trained to offer to deliver to schools?
Let's talk. Yeah, what we've done in the past, we've actually worked with the Milwaukee Archdiocese in the past, and we trained their staff member who was in charge of what I would consider like all professional development. So they offered mental health first aid. They offered our Notice, Talk, Act at School training. It was just really up to what the school they supported over 200 schools. So it was really I can't deliver to all those schools. So how do we partner to the most effective individual? So and I think that's also where the train the trainer model really is the most effective way. How do we train up more individuals to actually deliver the curriculum and then go out? What I'll say is we'll still approve or not approve, like going out to a school to make sure that they're ready. One of the big things is they have to have some sort of referral process, right? So there is some vetting that we like to do at the school just to make sure that we know that they're ready for that curriculum. So that's part of just that process of that partnership that we would ask to go through.
Okay, we have one more question from online. How would a school connect with you to bring it to their district and or school? And what staff are you looking for contacting you? Principals, social workers, et cetera?
Decision makers. So principals are usually the best individuals for us to work directly with, but we love to work with a team, most likely. Like, we understand that the support services team really needs to be a part of this process because they're people we're referring to, right? So we really like admin and support services team to really come together in the decision-making process. Best way is contacting Joy or myself. We also have, look at that, contact information. Oh, we also have, if you can see on the bottom of the screen there, schools@psych.org is kind of the general email that you can also send information or questions to. Joy and I both manage that email account, so that's another way to reach out to us. Yeah, and we're here until tomorrow too. So This afternoon, if you wanted us to meet tomorrow morning for whoever's asking that question, like we're happy to also come out to this school and have a one-on-one conversation. Or I believe for those who are in the room, and we'll be sending this out through Colleen as well, there's a little flyer that has a QR code. I don't think me holding it up to the camera will be effective to those online. But that is a Calendly, so you can schedule a meeting with us virtually, and we can have a follow-up conversation as well. We had a question here inside. Oh, can you turn on the microphone?
Outside of your pilot studies, has Notice Talk Act been heavily research supported in terms of evidence-based practices? I know you're utilizing evidence-based practices, but has this been vetted in the research?
So that's really what we're hoping with the SAMHSA grant, is with this 5-year, we have the funding to actually do it. We've been working with schools. Sometimes getting data can be a little difficult. So when we were having schools pay for the program, sometimes we weren't getting that data back from them in a timely manner. We launched our own kind of grant program, and we had 1 school the first year, we had 2 schools the next year, or 3 schools the next year. But that data collection, is still, Joy's trying to get the numbers from this last year so that we can crunch it and see, okay, where are we at with some of these points. But we're really hoping with this SAMHSA grant that we're able to actually show 5 years that these are trends that we can continue to replicate year in and year out, and in multiple different locations. From, again, LA is a different population than the state of Iowa, right? So, Joy, I don't know if you want to.
Yeah, can everyone hear me? I was also just going to add that, Chrissy mentioned this earlier, but we do work with the APA, the American Psychiatric Association Division of Research, and they are working with us to develop a pre and post questionnaire that we're also going to use for follow-up data. And so while we have some questions in our e-learning module already, we're building that out a little bit more so we can really measure, has there been a change in these staff members' self-efficacy for being able to have these conversations, for referring students when necessary, things like that. So we're really looking forward to this opportunity for us to gather this data with SAMHSA and with the APA and share that with people as time goes on.
And there's also, as a part of the SAMHSA grant, and because we're here because of that, it's honestly not just looking at the ways in which staff members are interacting with students. They're really interested, it's a mental health awareness grant is the name of the grant. They're really interested in how this training will impact the way, if I'm a staff member getting trained in this program, am I going to talk to people differently in the grocery store that I know because I've now been trained in understanding mental health a little bit differently? Or when my friend is going through something, am I more likely to say hey, did you know that there's an Oakland Community Health Network that you can get connected to, right? It's the way that they've asked us to think about even some of the data that we're collecting is even deeper than what we thought about our impact for addressing social determinants of health, really. And so I think that's been really good for us, honestly, in thinking about how does this change your behavior for the adults in your community, because y'all are influential people, right? You care about people, so how are you changing the way that you might interact with your faith community or some of these other places in which you find yourself outside of work? So, but great question, and that's why we're really excited about this SAMHSA grant and really trying to show, you can talk to Joy and us, we really want to make an impact. It's great to train so many staff members, say that we're going to impact so many students. It's about those 4 key measures for us. It's how do we reduce truancy, how do we reduce discipline referrals, how do we get suicides to 0 for students. I want to work myself out of a job in school injustice, quite frankly. If we can continue to show some of these trends, we might be able to do that. Question here? There's a question about what districts we've already been working with in Michigan. Y'all would be the first. We piloted with Michigan State University with their resident assistants, second-year resident assistants, second and third year for our college editions, because as Dr. Posios alluded, I have some roots at Michigan State University, have some friends at Michigan State University, so have tested it out there somewhat. And actually, oddly enough, we did that pilot site, would be 3 years ago. And one of the RAs that I trained became a teacher in the Virgin Islands, where we just did an NTA at school training back in September. So just a little, apparently NTA now travels from Michigan to the Virgin Islands as well. So hopefully that's some trajectory that y'all can take as well, because it's really nice. So
I have a question for you, Chris.
Joy, yes.
Can you tell them about our experience with Mount Pleasant High School and Mount Pleasant, Texas?
Yeah. So I talked about the grant program that we offered. One of the grants that we delivered to was Mount Pleasant High School in Texas. And what was kind of talked about with with that community was, let's test it out, right? Like let's see if it's good or not. So what we did with that community in particular is all the staff of the high school got trained, but we invited all the support services staff member from all the rest of the schools to see what the curriculum was, right? We already have one school, y'all are a grant program, we're willing to pay for as many people to get the experience as they need to. They liked it so much that this past year we trained their support services team through the Train the Train model, and they are delivering it to 900 staff members. The entire school district is getting trained. It's like 900 staff members. So it's our belief is once you see what we actually, like, we're giving you a teaser, right? Like a little bit of a teaser of what we offer. We really do believe that if one school in the Oakland community believes in us and we can invite more people to see exactly what we're doing, that's really where the proof is in the pudding, right? Is that a true saying? Is that a good saying? I don't even know if that's a real saying anymore, but Dr. Pozios.
The thing that I have been really impressed about this program, and the reason why I feel so strongly about inviting you out here to present on it is because I do think that it is complementary to existing programs. Somebody mentioned mental health first aid. This is certainly not meant to replace it, but rather to really complement it and empower folks that are working in schools to kind of maximize their own abilities in terms of assisting the kids that are at the school and not asking them to take on an additional, expertise or something that is, you've got enough to worry about when you're a teacher or a coach or what have you. And so that's really what I think is so great about this is that, it's a pretty common sense kind of approach in terms of, hey, something's off with this kid. Why don't I find out a little bit more about that in a way that is mindful of the student's, mindset at that time, and then how do I actually get the kid help? We always talk about that. We need to connect kids to mental health treatment, and really that's the biggest thing here is ensuring that there is that warm handoff. When the child is in your school and is having problems, to getting the, whether it's mental health treatment, whether it's some other support, Chris mentioned, social determinants of health, which is so huge, or other resources. How do we connect the dots from A to Z, to make sure that no one's falling through the cracks? And, sort of related to that, the other thing that I'm really impressed about this program is that it really dovetails nicely with there's been a push from the state to really encourage schools to be more active in the realm of threat assessment.
Yeah.
And again, I want to reiterate that, very few, kids that need mental health services are at risk of committing acts of violence towards others. However, one of the kind of central tenets of threat assessment, regardless of the model, is that you are assessing the behaviors of the person in question, and you're not necessarily concerned with psychiatric symptoms per se. You're really focusing in on behaviors. And so the fact that this program also focuses in on behaviors as opposed to mental health symptoms really, I think, again, dovetails very nicely with the threat assessment approach that is really being actively pushed throughout this county, certainly.
Okay, go ahead.
You got a question?
Kimberly has a question in the back there, but
No, we hold for Kimberly.
Kimberly, go ahead.
Hi, yeah, it's not a question. It's actually just a comment. And I enjoyed the presentation, for one. Thank you so much for coming and being here. The other piece is that I think I saw this program being available not just to the teachers or to the, the credentialed licensed therapists, but also to I think you said the janitor. I think you said the person who's serving the food in the cafeteria and that kind of thing. So I think by allowing those persons to be involved in this kind of training, you open yourself to the opportunity for them to, many times they are the ones who know the children better. Children are more open, honest, closer, walking, talking with them, just because you give me my favorite sandwich when I come through the line. And so when they notice that difference, you're giving them a voice. When people in those capacities oftentimes don't think they have a voice or they should say anything. I think if you open this up to them, you sit them at the table, you give them a voice. And then that voice is used when they notice something. They know what they can do with that. So I like that piece of this, that it is the entirety of the school who has the responsibility. It's anyone who touches that child in that opportunity. The after-school person watching, whoever it is, notices that change. They now know what to do about it and that their voice will be heard. So that's all I have to say. Thank you.
Coaches are included in that.
Oh, everybody who touches a
I
child.
think the janitorial staff, in my experience, even working at Michigan State University in the residence halls, they were the wealth of knowledge because they are usually, they're forgotten about, I think, to your point, right? So students are more likely to say things in front of the janitorial stuff that they're not going to say in front of any other adult. I think the food services staff, they're going to notice when a student who usually gets hot lunch stops getting hot lunch, right? We talked, it's not just about mental health, right? It's about all of these other things and how as a community, and just on Dr. Pozio's point, then I'll come back to you, Raul, is also how do you build this community response, right? Through threat assessment, one of the big things is who are the players in your community, right? How do you get a judge to sit on there, because people are going to show up when a judge tells them to show up. So how do you get them involved? Because if they're in charge of the whole court, well, there's a juvenile court, and there's things that are going to rise up, and they're going to become adults at some point. So that judge should probably be sitting in there, and the chief of police, like, how do you get all of these players together? Because I was talking to Dr. Pozios before, when the police or a law enforcement agency shows up at a house, not for a student, but somebody who lives in that house, that's a traumatic experience for that student, and that student's going to go to school that next day. And what is that behavior that might be exhibited in the school might be criminalized. And now you've just started this whole vicious cycle internally, and that's where we see generational families continue to go through law enforcement, is because we're not addressing how the system sometimes traumatizes the youngest person in the family and how that person then matriculates up through the system. So, Raul, you had a comment?
Yeah, so I just want to thank Dr. Pozios and his team for bringing us out. But a lot of this is not about selling you on something new. It is about the investment we're making, that's multi-million-dollar investment in Oakland County. So here's a couple of things that are going to happen. When you're on YouTube next, and I don't know when that will be, I want you to just put Notice, Talk, Act framework into your search. It's a nice little video. It's going to take you through a little more of the curriculum so you see how we operate. The second thing you need to be aware of is that when we leave here, we're going to Pontiac because we have received grant funding to get some resident fellow trainees. Up to 3 of those trainees, probably be about 15 across North America, are going to be at Oakland County Community Network. Again, another part of the commitment we're making. But the last piece is, and you're hearing some of the themes come out about the power of one. One day, one school, one county, one educator, one student. That's what's going to scale, because we already have some numbers in the queue, but none of the jurisdictions that were picked were done by accident or inadvertence. And there are a number of other jurisdictions. In our backyard, we had Alexandria, Virginia, call us today and ask, why did you get to the Virgin Islands before you got to Virginia? Now, some of that's environment, but a lot of it is, there is demand to not major in mental health first aid, but to just get a certificate to give me a little more help to add to my tool belt, which is what Notice Talk Act has done. So the overlay to this whole architecture that we're talking about, and I didn't plan to announce this today, but you should know about it first. It won't be a secret in about 2 months. So we are going to take the first $2 million out of our own treasury to launch a public education campaign around mental health, which is going to be the first in maybe 2,000 years positive public mental health education campaign called the First Step Campaign. Because what you're hearing now and what you're seeing, and we're experiencing it, I hear what you're saying, I kind of like it, but it's hard to take that first step to any change, because everybody hates change. Everybody loves progress. They hate change, right? So we're going to talk about the first step. The first step has 3 components over a 5 to 7 year period. 3 components over a 5 to 7 year period. For 2 years plus, all we're going to talk about is awareness of treatability of baseline mental health conditions. So when you see all these 1 in 5, 1 in 3, 1 in 10, chronic depression and anxiety, no matter how old you are, you don't have to suffer in silence. It's treatable, just like HIV, just like diabetes. There's more, and I can say this in a car town, there are more diabetes commercials on TV now than Ford and GM combined. Everybody's living their best life and their A1C score, right? We got to get that turn to change the narrative, to make mental wellness mainstream. When we get to the middle years of the First Step campaign, now we're going to be talking about how you talk to your mental health provider. Now, that doesn't have to be a psychiatrist like Posios. When you go to the gynecologist and you're having your regular checkup, how you feeling? Don't just stop at the physical piece. Put the mental piece on the table. You take your children to pediatrician. There are more pediatricians dealing with the mental health needs of our students than there are psychiatrists. Let's stay in the conversation. Again, we put $2 million a year into making sure people understand it's okay to not be okay. It's not okay to suffer in silence if somebody's willing to help you. And then when we get to the out years, what Oakland County is going to lead the nation in saying, which is why we're here first. This is ground zero. This is the Mercury of our Apollo program. We're here, right? There is no health without mental health. And Oakland County will be leading the way, and we will be on the bus with you, but you will be driving that bus in community, because how you roll out this program really is going to be determined by how you do it, right? So you're going to help us adjust it, and what worked in Texas, I'm a native Texan, probably not going to work in Michigan. What works in the Mid, probably not going to work in the Thumb, right? See, I did some homework, I know. I see. You know, so we want to make sure that it has a community base, but it all comes back to that power of one, right? And the good news is, while it's free because we have a federal grant to do it, you know, it's really complimentary at no cost to you. So a lot of times, whether it's Joy or Chris or your principal or your superintendent, oh, I love the idea, how much it's going to cost me. That's where we live, right? And it's like, I can't do it because it's going to cost me too much money. It is going to cost you some time. But worthwhile is not going to cost you some time. If we say we care about the power of one, are we willing to spend 1 more hour to get a little bit more information, to help 1 more student? If you close your eyes right now, you already know who the person is you need to help. And that person could be at school, that person could be at home, that person could be at your house of worship. But just close your eyes and say, who is the person who really could use this? I've noticed it. I don't know how to talk about it, or I tried to talk about it and it was a misstep. And even if I talked about it, what action could we take? And it doesn't have to be therapy. You know, one of the things we found out when I was in Harlem last week, because people had hand-me-down unclean clothes, students were truant. And it was just the ability to not want to be teased or bullied about the fact that not only were they hand-me-down, they couldn't wash them all the time. So I'd rather not go. And what one of these clinics was talking about is working with a grantor to actually bring washing machines to the campus and just make a community project out of, instead of doing kits and baskets, let's just wash clothes as a community. That's a social determinant issue. So again, not selling you on anything. What we're telling you is this is ground zero for us because we do believe, given the influence that you have not only in the Midwestern United States, but in this state in particular, if we get it right here, there are other counties all up, down, and across your state that could use this. And then they'll be saying, how come it took you so long to get here? But the pass will not be from Joy. The pass will not be from Chris. The pass will not be from Raul or Dr. Pozios. The pass going to come from you because it worked for us. And we helped one times. And then they could help one times and so forth and so on. So, again, I just thank you for being here this morning because it does show that we came to the right place. And we're just ready to get you to tell us where we need to go next. Back to you, Chris.
We got a question.
Hi. I just wanted to know, I know you talked about data in the beginning. I wanted to know in regards to, if you've looked at social media's impact and bullying's impact and what that looks like in regards to data.
Yeah, go ahead.
Yeah, so we have a group of psychiatry resident fellows that we work with. I work with a group of about 11 of them, and one of them last year wrote a blog, actually, that was based on a study that she worked on that was related to this issue, and that is on our website. So if you go to apafdn.org, you can find it, but we could also share the link with Colleen, and she can share it with the rest of you. I also have some fellows who are interested in potentially creating something for students. There are a decent amount of resources out there to support educators, although they could probably be more, around this whole topic of social media and healthy boundaries, et cetera, but sometimes they don't listen to them. So what is something that we could develop, a short video or resource or something for these middle and high school students about this issue? So yeah, there are some things that we're working on with this.
So that is a huge, every single school, social media is suicide, social media are 1 and 2 most of the time.
Just very briefly, one of the things professionally that I believe very strongly in and I've done a lot of work in is, how to look at media not as a harmful thing, but as a positive thing. It's very true that media can have negative impacts, but it's also true that we can harness the power of media and social media to really make positive change. And so that's something I would be very much interested to see the research that the APA Foundation has in the study that Joy alluded to. But I just want to keep that in mind, and how do we kind of work collectively to utilize media in a positive fashion.
We also had, and we could potentially share this, we had a fellow who worked on it's like a PSA campaign for she was out of Texas, and she worked with some high schools and middle schools out of Texas to develop a PSA campaign so that students would create their own PSAs around mental health or bullying, whatever that topic is that they think was most crucial for their student population, and then create a PSA that they could then deliver to their school so that, again, it's a student-led message that is also focused on what are the biggest concerns from them as well. And there's also some really good, what I would say is hopefully I don't get smited by Sparty around here, but University of Michigan Depression Center University of Michigan Depression Center did put out a peer-to-peer mentor guide that is probably one of the best that has ever been put out for free out there, and it's really about how students guide and develop their own mental health awareness groups and things like that. And I would highly recommend looking through that because I think there's some really good pieces of how other programs could look at, like, specific topic programs can look at how students actually lead those projects. So there's not just like, oh, I'm telling you to do this because we think you should do it. It's, no, we're invested because we care about this, and then how do they continue to push that forward within the school from policy changes and everything like that. So, a great question. Any other questions?
You know, let me just say this about
Yeah.
the fellows, because I don't think everybody knows what Dr. Pozios had to go through to become the guy that he is. So, a fellow is a resident trainee, so it's 4 years of medical school after college. Then 4 years of residency to be in psychiatry. In order to be a fellow in our program, you have to be a third or fourth year fellow. So of the 15 some odd residents there are in psychiatry across North America, less than 200 get accepted into our program. So that's how selective we are. Now, we are on a smart growth plan, but we'll never have every resident in the program. Now, Dr. Pozios is an alum of our program. So he's now the chief medical officer of this institution, but he was one of our Spurlock fellows, and he is about to be in May, when we get to San Francisco, the speaker of the House of Delegates in the APA, and that's sort of like the speaker of the House in Congress. So Oakland County already bringing leadership to the table, because in May, Pozios is the guy. And the fact that he's here, that we're here, we need to, for those of you who will take the big selfie with us, Chris gonna take a selfie. We need to send a message to the APA too, that the foundation's working with Oakland County and Dr. Speaker. Because everybody will then research legal, IT, communications, say, you know what, something is happening in Oakland County, we need to be a part of it, right? So Chris, get my phone, Pozios, swing around here.
We'll probably have to ask,
No, you can do it.
I don't want these,
Turn around, you're gonna do it this way. Swing around, don't even have to move. Duck if you don't wanna be on it.
if anybody, it'll work.
You might have to step up a little. There you go.
We'll go right into the corner here. Hey, and another. And tilt.
Golden Globes.
Yeah.
There you go. Any questions from that? I wish I could come over and ask you the questions, but last time, whew.
Any questions that us from OCHN can help answer from anybody here?
I will add, even though for the people online, any of the handouts that we had, we will make sure that we get to you. For the Oakland Community Health Network, we have some handouts on our School Mental Health Navigator program, as well as different magnets and cards and brochures on our services and resources that we offer.
And actually, Trish, I'm so glad that you mentioned the School Mental Health Navigator program, because, you know, raising awareness of that program and expanding a program like that is really what we're speaking about when we're talking about a warm handoff. Mm-hmm. You know, so again, the way I think about this program is that it just kind of standardizes the process of how to recognize a potential problem, and then how to assess it, and then deal with it and hand it off to appropriate professionals.
Yeah.
If there are no further questions, we have, I think, a bunch of breakfast foods left here.
It's gonna be brunch for some of y'all, so I don't want y'all to leave all it.
Definitely don't be shy. Feel free to take advantage of that. But thank you all very much, and I'll let Chris say the final thank yous here. But just personally, I really appreciate everyone that's come out in person and online to hear about this program, because, again, we've all been so deeply affected by, you know, the Oxford shooting and now the MSU shooting, and everyone's concerned about kids' mental health, and it's really time to do something about it. And, you know, that's why I'm so glad about that we've been involved in the work with the prosecutor's office, and we have built a lot of relationships to try to support kids in Oakland County, and this is just another next step. So thank you very much.
Yeah. Yeah, and as, my dad was born and raised in Flint, Michigan, so I have ties outside of Michigan State as well. So it's honestly such a great honor to come back to Michigan and continue to try to impact youth mental health because, you know, I feel like I'm a part of this community. I was telling Raul and Dr. Pozios and Joy that like all of my friends that I met at Michigan State are like from the Oakland community. Like, you know, this is where my kind of surrogate Michigan family kind of became when my time at Michigan was here. So just want to thank Dr. Pozios for this opportunity. Colleen, thank you so much for the organization and logistics. Trish, thank you for making sure I sound great up here. And then I just want to thank our chauffeur, Mark, who's going to be driving us around this afternoon to the visit that Raul and Dr. Pozios alluded to, and excited to spend some time with Kimberly as well, learning more about the center. And again, I want to extend my last words as thank you to y'all for showing up today, but more importantly, showing up each and every day for the students that you care about and the people in your community who are not just going through mental health, but are experiencing trauma and grief and all these different distresses that impact our ability to be full people. So, because that's really why I'm in this job and why I care so much. So thank you so much and have a good rest of your day.